Okay, thank you, everyone. We're calling the meeting to order. We do not at this time have a quorum of the board, so we will not approve the Zoom video from April at this point. If we achieve a quorum, we'll bring that back later in the agenda. But for now, we're going to move through our agenda to our first agenda item, which is our COVID-19 update from Dr. Mahdi.
Good morning, everyone.
Good morning.
We'll share screen. Can everyone see the slides?
Yes.
Yes.
Okay, I'm having an issue advancing. Just please give me 1 second. Sorry, everyone, just give me 1 second. All right, this is the COVID-19 data update as of May 16th. So for our sorry, folks, I may have to present in this mode because I'm having issues with the advance. So sewer said data has been showing increasing viral load in the wastewater for most of our jurisdictions in the St. Louis region. You can see that by the red circles that are clustered in the map on the left. Those have been progressively more than what I've been showing you in recent reports. The yellow circles indicate no change. However, even with that increasing trend, there hasn't been a statistically significant elevated viral load change in the St. Louis region. One thing that's very important for us to be aware of, though, is that this data does lag by 2 weeks. So this is something to continue to monitor over the coming weeks. So this is our St. Louis City COVID-19 epidemic curve. The average daily case count is now 6 times higher than it was 2 months ago. And I quadrupled from March 18th, and again, 6 times higher than it was 8 weeks ago. This is from a low of 9.4 cases per day to 57.9 cases per day on May 15th. Again, the overall case counts, if you look at the trend on the graph, are still low. But if you look at them across the board, they look very similar to what we saw in Delta. And this is with testing across the city dramatically decreased. People no longer going for PCR testing for the most part. And the people who are still testing, a lot of them are using the at-home antigen tests, which, as you know, we have no reporting structure for in the United States. So now we'll focus on new and current COVID-19 hospitalizations. The number of people currently hospitalized and newly hospitalized remains low overall, but again, hospitalizations are another lagging indicator. So we're starting to see the number of daily hospitalizations turn back up. If you look at the curve here, that's indicated by that rise that we're beginning to see here. Vaccinations are the best resource that we have to protect people and reduce the risk of vaccinations with these new strains, specifically boosting. And we also know that we now have therapeutics, including oral packs of it on the market that can reduce the severity of symptoms. And so we hope that those two, in this case of vaccinations, long-term interventions, and in the case of the therapeutics, more recent, will continue to have a positive impact on our hospitalization rates, such that this surge will not be as devastating as the Omicron surge. So what we see here are the CDC community level metrics. This is what is reported by the CDC currently for data. The city of St. Louis continues to monitor the 3 metrics recommended by the CDC. Those you can see right in front of you are the 7-day case rate, the 7-day hospitalization rate, and the percent of hospital beds occupied by COVID positive patients. Those give us an overall indicator of where we are in the community. To be clear, the county recently went to a community level of amber. We are not far behind, although we are currently still at a green level. The difference is there is also a transmission data representative from the CDC. And for that, we are in the red zone. The difference between the two is taking into account hospitalizations. So our hospitalizations number is what keeps us at a low community level, but our transmission level, which I now send out in weekly reports through our social media, and you'll start to get, we're going to be sending out data alerts as well that you'll start to get, and we'll include those transmission levels. We have been in the red for some time now, which is why we continue to strongly recommend masking indoors. When we look at COVID-19 case demographics by race, African Americans have been disproportionately affected by COVID-19 throughout this pandemic. However, in February of this year, Caucasians have made up the majority of cases, as you can see. This is an unprecedented change that is more recent, and this trend has continued into the spring. Asians have also seen an increase in their relative proportion in recent months. When you look at demographics by age, young adults aged 20 to 39 continue to make up the majority of new cases, which makes sense given their active roles in society, whether it be in the workplace, being parents, being caregivers, and generally being in places that put them at higher risk of actual transmission. Fortunately, the proportion of cases in the pediatric age ranges have decreased in recent months, and the proportion above age 60 has been level. So let's take a look at how we've been doing with our vaccination rates. The number of first, second, and third doses being administered has decreased to a slow and steady pace, but boosters saw an increase recently after the CDC's recommendation for a 4th dose in adults above the age of 50 to maintain immunity levels. We also know that the FDA approval for a booster for ages 5 to 11 is something that we are very happy about. And I also anticipate, based on national meetings that I'm privy to, that we will be having data presented for children below the age of 5 soon. So we, since my time here, we've seen close to 5% increase in overall vaccination in the city of St. Louis, and that's over a 6-month period, which is really great. But we need to get these boosted numbers up and continue to do targeted interventions to do so. So the last thing I'll talk about is, the fact that we do now have antiviral treatments through the Test to Treat program for mild to moderate illness. This is a federal program that provides antiviral medications like Paxlovid and remdesivir. And the goal of this is to reduce severe illness and death in people that qualify. And so there is a website available, a link available through our website that will tell you which locations are in the regions have this Test to Treat program. I've been in touch with the White House Task Force because we only have 2 pharmacies in our region that are able to do this. However, our FQHCs and hospitals and other healthcare providers are also able to prescribe these. So we are really encouraging folks to not only get tested, but to request treatment and not to believe that their age or overall health may be may prohibit them. That we have now expanded the criteria for who can get these medications, and there are very few contraindications to taking them. These are really, really important. So I will stop there and I will take any questions.
Any questions for Dr. Mahdi? If not, we will move to our next agenda item. And I see that, well, I thought I saw that Will is here. Dr. Mahdi, am I introducing you or Will for this next agenda item?
I can introduce Will.
Okay.
So as part of the agenda today, we were asked to discuss the new Office of Violence Prevention. I said that right, Will? Yes, don't want to get in trouble with the new boss. And so this is really an exciting endeavor that was born out of the fact that we have so many violence prevention programs that span a lot of departments in the city of St. Louis. These have been traditionally housed in Department of Health, but once I came on, I realized that, you know, we have not had anyone or any bureau, any one person hired specifically to oversee these vital and critical programs. We work closely with our partners in Department of Safety and other city departments. And in looking across the country, these tend to be overseen by their own separate entity that other departments feed into to support. And so we're excited to see this open up in the mayor's office. We're even more excited to see Will Pinky take the helm. Will has done this work across sectors for years and years and years now. He has been a close ally to the Department of Health and brings expertise, passion, and just a really keen eye for how to develop programs, strategic planning and implementation of these programs that I have been very grateful for. So I'll allow Will to introduce himself, talk a little bit about this office, and we can have a fireside chat type of Q&A around what's happening after Will has a chance to present. Thank you so much for being here, Will.
Good morning. Thank you for having me. And that's a great introduction. Hopefully I have that much energy this morning to live up to that. So nice to see you all. Yes, the mayor had spoken in her State of the City about proposing an Office of Violence Prevention. As Dr. Mahdi says, we have a lot of violence reduction, violence prevention programs going on. And as we came into the pandemic and the city launched Secure Violence and other initiatives, and the ARPA funds started to come out, we started to think about ways we could connect with local community-based organizations. We were fortunate enough to be asked and invited to join the President Biden's Cvi Cohort, which is Community Violence Intervention Cohort, with about 13 other cities across the country, which was focused on cities that were doing innovative work using ARPA funds to fund violence prevention programming. As part of that cohort, we get to meet with other cities and share best practices, but also help inform the administration's approach to alternate responses to violence other than just law enforcement, right? This is expanding beyond law enforcement. Law enforcement is an important part of public safety, but we really wanted to focus on initiatives and work that was being done at the local level and community to create safe and healthy neighborhoods, which is right as a natural connection, obviously, with the health department. So what this new office will do is coordinate citywide all violence prevention efforts. It will also seek out grants and fund community-based organizations to engage in violence prevention efforts. So what does that look like? I mean, we all know Cure Violence is a violence reduction program that exists in the city. Most of you should know that we have diversion programs currently going on. We have a call diversion program and a co-responder program that people refer to as cops and clinicians. We're looking to expand that to 24 hours. We're looking to expand to non-law enforcement responses. We have the Community Violence Intervention RFP that was put out recently and closed by the health department. And we are currently in conversation with 8 community providers who are at the local level doing various types of work related to domestic violence, substance use disorder, employment. So we're looking for those entities to work together, but those 8 community violence intervention contracts will exist within the Office of Violence Prevention. We're looking at launching restorative justice work. So it's going to include all types of things like that, work focused on juveniles. With the help of Serena and the Mental Health Board, we've been working with some people from UMSL and the Community Innovation Action Center. I hope I got that right, CIAC, to really start to focus on how we engage juveniles. We know we have a big challenge with juveniles being victims of or perpetrators of violence. And we want to try and get to those juveniles early on so that hopefully we can help them deal with the trauma that often leads them to engage in or be victims of violence. So the office is really going to be, like I said, that coordinating entity to work in community and to support great work that's going on in community. We are a part of a couple of other initiatives that sort of complement and support that. We are a member of a National League of Cities cohort of cities reimagining public safety. So you know, we're definitely going to be doing our best to make sure that we have a broad approach to violence reduction in the city. So I think I'll stop there, and if anyone has any questions.
So, Will, I'll start as well. One of the things I've really enjoyed working with you about is how data-driven you are and your approach to, we talked about the strategic planning and implementation, but just your approach to data, both data accumulation and reporting. Can you talk a little bit about your vision as it pertains to that and some of the things we've already started doing together around that, and what you'd like to see us do more, especially when you think of some of the smaller community organizations that from an equity standpoint, you made sure we're, the 3 of us, me, you, and Serena, made sure we're represented equitably in that our most recent RFP, and how we can continue to support entities like that may not have the resources available. But I thought it was really important for you to be able to talk a little bit about that too.
Yeah, so yeah, it's all about data, especially when you think about equity and you think about a city like St. Louis and in other cities that are really segregated and have had years of disinvestment in certain parts of the city. So even I'll use the Cvi RFP as an example, where we were really deliberate in thinking about the communities that we wanted to target initially. We'd love to have a lot more money, so we have to deal with the amount of money we have. And we want to make sure we target it, right? So we use data to identify the areas in the city where we see the most violence, right? Or where we see the most, the disinvestment in things that address or result in root causes of crime. So what does that look like? That looks like not just looking at crime data, right? It's very important to layer crime data and layer, where kids are and where different aspects are onto maps to have an understanding of that. And I'll give you one example that we've been talking about recently in terms of going forward. There's a software called risk terrain modeling, which I think MHB, someone at Violence Prevention Commission, has done a little bit of work with, but we have been really looking at that as we think about this community approach to violence reduction and looking at place-based data to understand where things are happening so that we can have conversations with communities about responding collectively to those places and developing initiatives. Data, I'll talk a little bit about summer programming too, right? So when we think about kids and we think about safe spaces and we think about ways to address the victimization of violence of young people, we did a lot of mapping, once again, layering on where kids are clustered in different age groups, where schools are, where programs are, where summer employment is. We really layered on a lot of different information and factors to say, where do we have gaps, right? A lot of our approaches are making sure we get into the gaps, because to me, when we focus on gaps, we focus on equity. Oftentimes people are doing great work, but they're not doing it in the places where people are, right? And in doing place-based approaches, you start to eliminate barriers, especially transportation, which is a big barrier in this city because of the infrastructure that exists. In terms of really thinking about data as people are doing work, creating a standard is really important as we approach this work, right? It's not a secret, I don't think, that data has been a challenge in this city, and this is a challenge in a lot of cities, especially for smaller organizations. So how do we now make sure, as we have people who we're engaging and who are providing services, we're making sure they get us the right data so that we can evaluate on an ongoing basis the impact of the work we're doing. In the diversion work, that looks like monthly data, that we're not just focusing on referrals, we're focusing on outcomes, working with partners and really engaging people who we refer people to make sure we're getting information to understand the impact and outcomes related to those referrals, right? It comes to providing technical assistance, right? Hopefully this office will be getting grants that will also support technical assistance. Once again, with our partners, the CVI grant, we were able to partner with Simply Strategies to provide technical assistance for people who are applying for the grants to make sure we're equitably engaging and contracting with organizations. So it's not just the same big and large organizations that are getting monies. It's also small organizations that we need to build capacity in these contract negotiations around CVI. That's something I've been telling a lot of the people we've been engaging with. We need you. We need more. We need a bigger bench. I'll use a sports analogy. We don't have enough organizations that are able to do this work, that are able to respond to RFPs. And in this CVI RFP, I look at the group of 8 organizations as a cohort. So a lot of this is also, when we start thinking about standards, when we start thinking about data, it's also collaboration and making sure people are doing what they're best at doing. So we've talked a lot about, we're going to be meeting, we do this in a lot of work we do already. We're going to be meeting bi-weekly to make sure we're understanding who's doing what, who's working with who, and then it's sharing data so that people don't feel like they're on an island and we're just giving you money to go do something, but there's no supports. And you may not have the capacity to do something, but maybe you're not connected enough to understand that there are other people who are doing this well and that you can refer the clients that you engage with to. And so we are going to have strict really focused data standards in terms of reporting, because we need to hold people accountable, not in a negative way, but because we do want to create that standard. So hopefully that I touched on the things you wanted me to.
Absolutely. And I think that to me is really important. We've already started to see that work where we have epidemiologists, Matt Haslam, who's on the call, a champion of epi across the board. And then we also have St. Louis University working with us to provide data and reporting. So Will, the last thing I'll ask before I open it up to questions is public health. We know the importance of public health within the sphere of violence prevention. And we know that gun violence is a public health crisis. You have with you not only the director of health, but you have now a very active and willing board of health that supports us in the city and all we do. What kind of support would you like to see, or public health initiatives or public health support, public health priorities through this office moving forward, and any requests of the Board of Health specifically as to how they can best support you and all of us in the city as we do this work?
Yeah, great question. One of the ways is what we're doing now. I mean, sharing information, making sure we're understanding what's going on. A lot of times people hear in those conversations how they could be supportive, but I've told people a lot, especially as we think about the diversion work. The most important piece is the system of care, right? It's where we're sending people to. Is that system structured in a way where we have enough capacity to do the things we do? Is it structured in a way where we have enough of what people need, right? And so I would hope that the Board of Health could be really supportive as we think about, our hospital systems and our emergency rooms and the work we're doing to try and decrease the unnecessary trips to the emergency room, but also make sure that when someone does go to the emergency room and they need it and they need services, psychological services, we can get them to those services more quickly, right? As we think about juveniles and trying to really engage them more upstream and get them the help they need more quickly. If we're thinking about like an assessment center for juveniles, I would hope the Board of Health could help identify and support, the creation of that in terms of location. And once again, what happens as we identify the needs of juveniles and get them to the places where they need to be and their families, right? Because the difference with juveniles, maybe not the difference, but it's more pronounced that, you're going to definitely bleed into the family as you deal with juveniles. A lot of times when you deal with the adults, the kids may or may not need something, right? So how do we think about those holistic services even as we engage juveniles? So yeah, I think for me, it's really around, as we think about asking the organizations that we're referring to say, hey, we need you to provide this data on these people's follow-up data 3, 6 months, a year later. And that's not something they're used to doing. We need the support of people on this call and others in the health and social service community to say, yeah, while this is different, this is important. And this is about us working together. I know there's a saying that I came across one time that I thought it was really good, and I probably don't have this right, but I think is if you want to go far, you go with the private sector. If you want to go deep, you go with government. No, so if you want to go far, you go together. But it starts out, if you want to go wide, you go with the government. If you want to go deep, you go to private sector. But if you want to go far, you go together. So I probably messed it up. But the last part is the most important part. We got to do this together. We got to build a team within the city, not just with the Department of Health or the Board of Health, but with everybody, right? And until we start working together and targeting or attacking this problem together to address these root causes, we're not going to really win this battle. So
I love that. I think that's a great place for us to stop. And then I'll hand it back to Serena for any questions.
Okay, does anyone have any questions for Will or Dr. Mahdi? And I have a question, but I'm not going to start off. I want to see if other folks have questions already. Dr. McBride, I see your hand is up.
Yeah, yeah, thanks. And thanks, Will, for being here and engaging with the board. And just say that, as Dr. Mahdi said, I want to be supportive. And we have an academic health committee as part of this board, which represents not just, it represents SLU, but also UMSL and WashU. And I've come from WashU, and I know if you have data needs, I know there's a real commitment at the Institute for Public Health to help in this regard. So reach out if you want to through us, or you may be doing it already, I would expect. But
We're working closely with Victoria and Worry and a team there, Dr. McBride, and have just started that work. So that's been enormously helpful. A lot to do, really difficult. This is a very different way of engaging a very high risk population. And so it requires a lot of thoughtful work, and we've been very thankful that they've been willing to engage with us. Sorry, back to you, Dr. McBride.
Oh, no, that's fine. So, I figured you were already connected, and one other connection you may not realize, but, I sit on too many boards, but I sit on the board for the Justice Services Center in the county. So, there's a lot of connections on these issues that we talk about some of the same issues at the Justice Services Center. So I just wanted to point that out too. So thank you for all your work you're doing.
Oh, thank you. And evaluate, I'm remiss in not mentioning evaluation, right? I mean, we need to make sure we're evaluating these things. So definitely that's where a lot of that support comes in. Thank you.
Linda?
Thanks very much for your presentation. I greatly appreciate that. I think we're all probably mindful, especially in the aftermath of Buffalo, the degree to which racism has played such a pronounced role in gun violence in this country. And I think it was probably about a year or a year and a half ago that this board passed a resolution stating that racism is a public health issue. So we are united with you in your efforts to incorporate any efforts to defeat racism as a cause of gun violence. And so I just wanted to sort of insert that into the dialogue. I mean, I think we're all very mindful of our country's youth and what we can just echoing everything that you said about trying to find community supports, identifiers earlier on in the process, et cetera. And a big sigh of relief from everybody here that our legislature finally voted to fully fund Medicaid. So hats off to Dr. McBride on that as well. So thanks.
All right. Any questions? Any other questions or comments? So one question that I have, and this is just me trying to understand if there's a formal intersection between the new office and the Department of Health as we look at how we count activities or outcomes or accomplishments through the CHIP-CHA process. So if we end up with violence prevention as still being a priority for the city and county health departments through CHIP-CHA, are we able to then, I don't want to say count, but are we able to credit what's happening in this office as a part of the DOH strategy, or will we still need to have separate activities to support the CHIP-CHA priorities?
Yeah, I can take that. So since this is still, this is being built out, but there's a lot of transition because of how complicated it is to have a standalone office, that does not affect how this is counted towards accreditation and CHA-CHIP, especially because, and Will correct me if I'm wrong, the way that this is being thought up is it convenes offices rather than creates a new one and removes the work being done. And so far, there isn't really anything that's been worked on that Will hasn't been in contact with or worked with me on. I think this just helps with coordination better. So this will not change our accreditation process, the CHA-CHIP metrics and how things are counted. It won't.
Thanks. I know that was a kind of in the weeds question, but
yeah.
All right. So if there are no other questions, thank you, Will, for joining us and for sharing that information. And I'm actually going to circle back up to our first agenda item because we now have quorum. And I'm going to ask if I can get a resolution to approve the Zoom video from April 21st of the Board of Health meeting as our minutes or record of that meeting. I see Dr. Jeffra moved. Can I get a second?
Second.
Dr. Nicholas, sorry. And then all in favor by voice or hand?
Aye.
Aye.
Opposed? Abstentions? Okay, motion carries. Thank you. All right. So we will move to our board committee reports, and we'll start with Governance and Nominating Committee.
Thank you, Serena. Our committee did not meet this past month, although we do hope to be working in communication with Dr. Maddie about setting up some orientation materials for our new board members, and then hopefully any other board members that want to join that session will be able to do so. We're also working with Kimberly and Michelle Turner, some other staff, on pinning down all of our board member expiration terms exactly from the mayor's office. And once we have that information, we'll be turning our attention to figuring out how many open board slots we'll have in 2023. So hopefully I'll be able to come back to you next month with those numbers. Just as a reminder to our board members, we serve 4-year terms and we have term limits of 2 terms. So you can be on the board for a maximum of 8 years. So, but hopefully more next month on exactly how many openings we anticipate having next year.
Thank you, Linda. And if I can just tack on to that report, I know as a part of the orientation, we're focusing on the new members. We also are inviting existing members to attend to get a refresher or to get more information. And once we get through that process, I will be reaching out to the new members for committee assignments. So we are thinking about how we rebalance the committees and looking at the existing workload of the committees and whether or not we need to make any adjustments there. So if you're a new member and you're wondering, why am I not on a committee yet? It's because we're getting through this orientation process first.
Great.
All right. So our next update is from our Academic Public Health Collaborations Committee. And Craig, I will say that I have talked to Dr. McBride about chairing the committee, and we plan to follow up with you to kind of get an update on where we are so that we can transition that, but we appreciate you doing an update for this meeting.
Okay, so we had a meeting with Spring Schmidt who is with Missouri Center for Public Health Excellence, and also connected with St. Louis University, of course, doing some of the work previously done by others related to a lot of the work of connecting us academically. There are some additional monies that have been available from the Missouri Foundation for Health. In those dollars, the effort is looking at our workforce development plans, both in St. Louis City and St. Louis County, as well as a learning agendas for individuals within those departments, as well as some organizational learning agendas for strategic skills. So there's effort with a number of focus groups and interviews going on currently to try to put that together. That's a heavy lift. I did raise, obviously, the tremendous support that's been expressed primarily by Dr. Ross and Dr. McBride, but certainly by others as well from this board. And obviously that is going to be greatly appreciated. And so that will be part of the efforts moving forward. We need to really get this core piece together, because part of this, in addition to doing the strictly academic pieces, is having our academic partners in terms of professional development for the future of our own individuals who are within the respective departments, as well as attracting other individuals who will have professional development pieces as part of that. There was talk about the issue of some of the performance management issues. We heard from Will, and we always hear from Dr. Mahdi about this, and hear from the board as well in terms of some of the metrics and measurements and so forth in terms of performance management. And so there will obviously be some efforts as part of that as well. And Dr. McBride has indicated, I don't see Dr. Ross today, but he as well has talked about how we expand that into, obviously UMSL has been doing a lot of things with regard to crime reduction, crime prevention, and all of that. And Serena, all the efforts that the Violence Prevention Commission has been doing. So a lot of great things coming together, and I expect and hope that we will all be a part of that moving forward as part of this academic collaborations. The academic health department portion of this was launched as part of a grant from the Missouri Foundation for Health, which is ending, but that doesn't mean that we don't have a lot of opportunities to continue working together. There are more and more of those opportunities, obviously. Thanks.
Craig, I have a question. When you say the grant is ending,
Yes.
was the grant funding like a staff position and now you don't have staff, or what does it change?
Yeah, so the funding was primarily for us. Before COVID, the opportunity would have been for a number of the public health staff to be able to go to St. Louis University and do some of the teaching in the classroom, and vice versa for Sue to come here and get an experience both in the city and the county. So that time would have been supported. So it was mostly for personnel, and also then for some of the research efforts that we had for for some of the publications and so forth that occurred. And also currently what it's doing is helping us to do those learning agendas, the workforce development plans and so forth. So it's compensating for that.
Understood. Thank you. All right. So for our Health Communication Committee, Lisa is actually on vacation, which is why she's not here in the meeting today. And that committee has not met, so there's no update for that committee. I will turn it back over to Dr. Mahdi for department updates.
Thanks, everybody. So the first major update is that I will be presenting the proposed budget for fiscal year 2022 to 2023 at the Ways and Means Committee meeting for the Board of Aldermen this coming week. My hope is that I will be able to report an exciting new budget that will have been passed. So I'll move on to the different bureau updates. So from Environmental Health Services, we're having an all hands on deck community engagement event that's organized by our Environmental Health Officer, Amir Tibbs. It'll be held this Saturday, May 21st. We would greatly appreciate board participation and board support. If you cannot be there personally, to please send this to all of your networks. I will ask him to put that in the chat right now and to also email this board directly after this meeting the details for that event. The purpose of that event is it is a community cleanup and engagement event at O'Fallon Park. It'll be this Saturday from 9 a.m. to 3 p.m. I genuinely need your support because I was previously already booked to not be in the city. So will not be there physically, but will be well represented by our team. Thank you, Kim, for pulling that up. And so it will be community cleanup. We will also have resources from Parks and Recreation, Citizen Service Bureau, and the American Heart Association will be available, along with a friendly kickball game with the community members and Department of Health. It really should be a great, great event. We will also have vaccines on hand with gift cards for the first 40 people that attend. So please get the word out. Kim will email you after this meeting with this flyer so that you can get that out to your networks. But if we could have at least 3 board members represented on Saturday and have a great show out, that would be fantastic. So 9 to 3 p.m., a wide range of time to show up and show some support. Very proud of Amir and the rest of the department for this incredible, much needed event. And I am so impressed by it that we will actually be trying to do 2 of these annually. So we'll try to do another one in the fall and target other much needed regions in the city that need this type of cleanup support, and use that as a public health focused event to be able to bring critical resources and education to the public. So very, very excited about this, very proud of Amir and the department. Food and Beverage Control has had a successful transition to online applications for temporary food permits. This will go a long way. As you know, the cities has been shackled to being all paper for as long as they've existed. And so I know that it's Mayor Jones and a lot of us' priority, yes, Craig, priority to get a paperless ASAP. It will improve efficiency and accuracy for all of our systems. So we're very excited for that. And then our environmental health services continue to work on filling vacant positions. We have a new animal control officer and a health services manager 1 that have recently started, and interviews for environmental health officer and community sanitation program underway. This has been the focus of my leadership since coming here. I take great pride that the Department of Personnel has told me that I'm breaking records and hiring people, but retention is key. The turnover is what continues to hurt us, and that has to do with equitable salary and healthy work environments for our staff. So with the, we continue to advocate. From the government services analyst side, the great Craig Schmidt. Craig, I can read these, or do you want to say a little bit about the Community Resources United, the St. Louis Health Department, and policy initiatives?
Sure. So the Community Resources United Stop Heroin, we have been working together as a small portion of that to look at a toolkit that was designed for law enforcement to be at the helm, as well as working in communities of persons of color. I can tell you that we blasted it quite a bit because we didn't think that it didn't seem to really recognize what law enforcement's role was in the community post 2014, and did not seem to take into account at all some of the issues that we have with regard to persons of color within our communities and the specific needs that they have. So we worked on that, and it was with a group called the National Mental Health Institute, I believe. Also, Dr. Mahdi was most involved, as were a lot of folks within our community, in terms of supporting with data and information regarding get the lead out of school drinking water. That was a success. It was added to, in only the way that they can do in Jefferson City, it was added to an omnibus bill for education. But the good thing is that it puts down to 1 part per billion, which still is probably not low enough, the level that one can test water in for our children that they're drinking on a daily basis, and requires the testing as well as putting in filtration for that. And was there another piece that I missed, Dr. Mahdi?
Nope, that was wonderful.
Okay.
Thank you,
Great.
Craig.
Thank you.
I know they prefer to hear your voice than mine, so.
I don't think that's true.
And then last but certainly not least, our communicable disease and women, children, and adolescent health. This is the last year of our current STI contracts. We'll release a new STI RFP in the fall. This is so important. We recently released a joint statement and data around the increasing STI rates in the region with the county. This should be of great concern when you consider the fact that this was through a pandemic where people were underutilizing services. So we definitely continue to have an urgent need within the community to address this. Very excited to work with Dr. Hillary Reno and the county on this, and thankful for the work that the Department of Health is doing. We're also finalizing an MOU with Homegrown STL to include potential funding to expand the work done by both entities, focusing on Black men. We are resuming lead asthma education and food RX outreach in the community, as well as CPR classes. All great to engage since those had to be put on hold during the pandemic. And we are seeing COVID cases slowly but steadily rising, as I recently said. So our staff are working well to support high-risk groups. As you know, contact tracing is no longer being done in the city. And so we are focusing on really assisting key populations that need it, including and most notably our schools. The Metro ads for the Take Me Home initiative are in the works. Stay tuned. And we are preparing for the first in-person Pride Fest since 2019. Department of Health will have a significant showing there, and we will reach out to the board as to how you can be involved and join us. And last but certainly not least, our TB and refugee health program is preparing to receive Ukraine refugees and support them through this difficult time. And so we are proud to provide that level of support to our refugee community. So I will stop there and take any questions.
I have a question, but I want to see if others have a question first.
Yeah, I just had a quick question. Dr. Mahdi, as the race for county executive heats up in St. Louis County, Dr. Page has brought up, and one of the issues that's gone on in that race is the fact that Dr. Page signed an executive order committing the county to providing reproductive and sexual health services. And I know that in the city, our Board of Aldermen, I think, has passed a similar kind of order. I mean, our department is so involved in providing these services. You know, we've been enmeshed in this work for years, et cetera, et cetera. Have you ever considered possibly signing some kind of an order, or maybe having our board issue some kind of a resolution similar to what the county did on reproductive and sexual health services?
I'd be very open to that. As a new director. That's not, you know, an order that I'm aware of intimately. So I would really welcome that being brought to my attention, reviewing it with this board. And this is an absolute crisis, a priority of ours. We need to do whatever we can to support reproductive health of women with the impending changes that we know are coming, specifically in our state. And so I would definitely be open to reviewing that and see what can be done, and working with the county to make sure that that's a regional initiative and in alignment. So we can talk offline, but and I can discuss this with Serena more. But this board has been well positioned in the past to decide what priorities they need to take a stand on, and to making those available. So I would be thrilled to support that.
Right, hear that. And so I'm happy to follow up with Serena. Thank you very much, Dr. Mann.
Absolutely.
Dr. McBride, I see your hand is up.
Oh, yeah, thanks.
Oh, sorry, Dr. McBride, before you go, and just as a matter of priority, the monthly meetings that we have with the county, I will ask that this be on the agenda item, Linda, for discussion as well. But I do think that the board should still move along with how they would like to, what they would like to see represented, and formalize that so that we can move this along.
Okay. And I'm mindful, Dr. Maddie, that I probably should have mentioned this to Serena before I raised it here. So I just want to make sure that you confer with Serena and that we're all on the same page. So thank you.
Dr. McBride?
Yeah, thanks, Linda. I'm glad you brought up that issue of women's health, because it's probably frontal thinking about a lot of us right now. We're very concerned about that. So I definitely applaud that effort. And so thanks for that. You mentioned homegrown St. Louis, Dr. Mahdi, and I just sort of want to mention that I've been working with that group and Dr. Sean Joe on that, and they have an initiative to I help them identify the numbers of Black men that are uninsured and eligible for Medicaid in the city and the county. And there's 10,000. So they've been trying to launch an effort to enroll them in Medicaid expansion. So as you know, probably the expansion enrollment is lagging, but it's been picking up a little bit lately. We're probably at about 2/3 of what was projected, but there's a lot of really good efforts going on through that group to try to reach out, in particular to Black men who've never been eligible for Medicaid expansion, Medicaid before. So single men in general. So I just wanted to call that out. And appreciate your efforts working with them.
Thanks, Dr. McBride. Other questions or comments? So Dr. Mahdi, I had a question. You mentioned something that I think you called Get Home Safe. And that was my first time hearing that. Can you just give a little blurb on what that is?
You said Get Home Safe?
Yes, it was, Craig is shaking his head. Maybe I didn't hear it right, but it was towards the end of your updates. It sounded like you were saying that there was an initiative where you would have some additional metrics.
Oh, no, looks like the Take Me Home initiatives.
Take Me Home initiative. I don't know how that turned into Get Home Safe in my head. But either way, can you just give a little bit about what the Take Me Home initiative is?
Sure. I want to first see if there's the Take Me Home program is one that was initially developed. Hold on one second. I have this beautiful blurb that I usually use for this. Hold on. One second. I have this slide that I usually am able to bring up. Did I send those slides to either you, Kim, or?
Yeah, if you can send it to me, I can pull it up.
Okay, hold on. Okay, they may take a while to get you there, but so the city of St. Louis has this Take Me Home program as part of ending the HIV epidemic. And it is one where we have test kits that folks can take from home. There's a website that I can put in the chat called takemehome.org. But these are test kits that allow people to be able to test their status from home and then report. So this has been, we have broken the thresholds for what we were hoping to get out by number of tests in the community. But as you can imagine, you have to build out the infrastructure to support such an initiative because it requires being able to engage with the community, being able to get the community to then engage back with us around what those results are and to build out a reporting structure to support that in concert with our traditional testing methods. So our health stop focus at the Department of Health is a physical space where people can come for a range of testing needs, but we also want to think about the stigma, the privacy, and even the disparities around being able to access services. So having these at-home test kits has become a really important part of this. So this is one of our most successful initiatives around ending the HIV epidemic. I just put the website in the chat that can talk to you a little bit about this. Yeah, so that's it in a nutshell, is the ability to be able to have these at-home test kits.
Thank you. That's very illuminating. I wasn't aware of this program, and I'm glad that you took a little minute to fill me in. So this is great.
Well, that's a great plug for the next meeting because Tyrell has done a phenomenal job in educating the public around this, has presented at some major meetings. So I'd like to have him present at the next board meeting, if that would be helpful, and give a little bit of an update on ending the HIV epidemic in general, but also on this initiative. Either that or maybe a presentation on the increasing STI rates in that report more recently. So whatever the board would think would be most helpful.
Yeah, I think that sounds like a good idea. And if board members just want to weigh in on the chat, either way, that would be helpful so that we're not setting the agenda on the fly. But I do think that's a good topic to present next month. My other remark is a comment, not a question, but I've heard you talk a lot about the challenges around staff retention. And I'm thinking about an initiative that I'm working on with educators where they're planning to do a staff wellness day in July, and it will almost have like a retreat spa feel. And we've done something similar to that for our partners in the court. And I'm asking if there's interest from the board to really think about how we can create opportunities that support, uplift, and recognize staff, not just on the calendar year day of appreciation for professionals, whatever that might be, but really think about something that supports retention that we can contribute to the Department of Health. That seems like it's something that I work on for other initiatives and other groups that I'd like to be able to contribute to our team with the Department of Health. And I'm sure there are other board members who might also be interested in thinking about how we can support some of those retention efforts.
I
So
cannot tell you how important that would be. And I really thank you, Serena, for stepping up in that regard, because this board has been, discussing for a while, what's the best way we can support, what's the best way we can support, what's the best way we can support. And for me, it's recruitment and retention. Kim, I'm going to ask you to just pull up the information about the job fair. So to that extent, the Department of Health has never had a job fair. I'm breaking that. We're going to have our first job fair at the end of June. We have put together an active listserv of all public health related entities, healthcare related entities. We have a listserv of businesses of 1,000. I want to just uplift and introduce Terry Hill, our newest executive assistant to my office, who has literally been on the job for a week and has done so much. I can't even tell you this woman and how she works, but has already convened the entire listserv for this job search that also includes nursing department. So what Kim has on your screen, and you're going to get an email this week, actually today by end of day. Kim, let's make sure that all the Board of Health members are on our listserv. I think they were when I checked with Terry, but I need support for 2 events. Public health has been woefully disinvested. We, public health in the city of St. Louis comprises 1% of the budget. During my tenure, we need to at least see that get to 5%. Missouri is the 50th, the last place state for investment in public health, from a range of $7 per head to $215 per head nationally. St. Louis is at the $7 per head mark. So we need advocacy at the city level. We need advocacy at the state level for investment in public health. Go back one. So to that extent, for the first thing is we're going to be having a public health town hall. We'll talk about the new normal. We'll talk about our latest initiatives and a very, very exciting announcement for the next fiscal year of the health department. And then a Q&A. I want to also introduce my leadership. You always only see the directors and commissioners of the city, which makes no sense to me. The bureau chiefs are incredible people who do work. And more you've seen me do employee spotlights and things of that nature. We need to showcase the variety of work that the department does. I would like to challenge every single board member to make sure that 10 people in St. Louis are signed up for this town hall and actually show up. 10 each. You guys always ask me how you can help. You got now and June 1st to be present yourselves, but to make sure that you are responsible for 10 people. We have set a goal for 150 people showing up. In the past, I've only ever seen 20 or 30 people, and they're usually off camera, so who knows if they're even listening. I want 10 people from each of the board members on camera for this. And this is also a challenge to people in the community as well. Let's show that public health matters. Let's show that we need investment in public health. We can only show that if people show up and show out. The ARPA survey is still up. It closes in a week. I need everyone in the city to go fill in and prioritize public health. Thank you. You can go keep it back up, Kim. I'm on a roll. So the last thing that you guys will be getting that I'm challenging you for is the job fair. So again, Terry, thank you very much for Terry. A week on the job has put together a huge listserv that includes all the nursing schools, public health entities, and businesses, as well as our partners, to register for the first ever Department of Health job fair on June 21st. I have asked for a record number of new positions for the health department next year. I need people. I need good people. I need passionate people. I need people who understand that they may be making a little bit of a sacrifice at first, but the mayor has already announced a 3% increase above the base for jobs for City of St. Louis employees. Please have people come out. And I challenge you again, break records for the first ever job fair, Board of Health members. Okay, I'm done now with hopefully my enthusiasm woke people up at the end and has inspired people. I want 10 people individually. Dr. McBride, 10. Serena, 10. Linda, 10.
Dr. Maddie,
10.
could you or a member of your staff send an email with all the information about the town hall to all of the board members, so that we will have the whatever link and information to be able to disseminate?
Thank you for saying that, Linda. Late last night, Terry, Kim and I finalize said email. It will have the link to each registration embedded. It will have all the information, and it will have the challenge of 10 people on camera from each.
What a
board.
surprise, you're a step ahead of me, okay?
Listen, they don't pay me the medium bucks for nothing. I'm doing work out here, Linda. We're doing it.
Okay.
Anyway, I'll stop there before I embarrass my staff any further, but I will embarrass myself for public health. Please know that. And so really looking for support for these two initiatives and very excited about the job fair, one of many to come. We really want to get people passionate about working in public health. Thanks, everyone.
Thank you. And we do appreciate your enthusiasm and the direct call to action. I think sometimes our orientation is to form committees and task forces, which is good for long-term work, but then there are also immediate things that we can support you with. So we appreciate you highlighting those. All right, Dr. McBride, is your hand up?
Yeah, and never apologize for your enthusiasm, Dr. Mahdi. So, and thank you for waking me up this morning. And I was going to say the same thing that Linda said. If I could get the email, then you've challenged me, so I can try to get some of my colleagues to show up on the job fair. My question was, and I should know this, probably on the website, I'm there now, about how many jobs you have open. I mean, this is a kind of this graduations tonight and tomorrow, so it might be an interesting time. There are people looking for jobs. So.
Hold on 1 second. Let me see if I can put this in. Job fair HHD. So to my staff, I sent out a list of every single job listing in the city. So Kim, do me a favor, when you send out the Amir's, the community event that's going only to the Board of Health, can you also send the PDF that we sent to the staff with every single job listing? I'm gonna see if this copies and pastes well into the chat. Oh, I'm scared.
Dr.
Yeah.
Mahdi, I did just put the website for the Department of Personnel's jobs listing. That is for all city jobs, including Department of Health positions.
Thanks.
That allows
Let me
for online applications.
Let me just share screen real quick so you can see something. And then Kim, you'll be able to see what I mean. Can everybody see what's on the screen right now?
Yes.
Okay, this was part of an internal department sort of recruitment effort, but you're paying attention to the list here. So these are the lists that currently are open at DOH. And then you can add hopefully another 31 if my budget for next year is approved. New positions that I'm adding to the health department, including a new bureau that I'll announce at the town hall breaking news. But this is the current list, and there'll be 31 other positions, one for a new bureau and others for some of these sections that we've asked for in next year's budget as well.
Thank you.
So in line with what Serena was saying, when you get these, what I'm looking for is for you to use your networks, committees, organizations, your places that you can post these jobs as well for us. And we'll try to get those to you on a monthly basis moving forward so that we can increase people's applications. But this job fair and the town hall are the two main asks. 10 people each for the town hall, at least 5 for the job fair. Thanks.
All right. Thank you, Dr. Mahdi. Do we have any old business that we need to raise today? Any announcements? All right. Our next meeting will be June 16th. That's the only announcement I have. So if there's nothing further, we can adjourn. We don't have to have a motion to adjourn. We can just adjourn. So I look forward to seeing everyone next month. Thank you for your time today.
Thank you.
Thanks, everybody.